My problem. Hi, my name is Bob Dittmer, and welcome to Explorations in Public Relations. This short series of video presentations explores and illuminates the practice and profession of public relations. Today, we will be exploring the practice of public relations in the hospital and healthcare arena. Our guest today is Fred Bagg. Fred Bagg is a 30-year-plus veteran of healthcare public relations here in Indianapolis and also serves as the chair of the PRSA College of Fellows. Fred, thank you for joining us today.
Thank you, Bob.
Fred, let's talk about public relations in healthcare. Can you characterize what the kinds of things that you do in healthcare are like in public relations and how those might differ from, say, a standard corporation?
Well, I think that there are a few things that make it different. One is the complexity of healthcare today and its ever-changing environment. It's kind of like a moving target. And so we have some difficulty for people who are not familiar with the field trying to come in originally. But other ways, it's like other public relations roles in that it's about relationships and trying to maintain those relationships, establish them, fix them if they're broken.
If a young person were to enter public relations through the healthcare front door, what kinds of things would they find themselves doing on a day-to-day basis?
Well, an entry-level professional, for the most part, is probably going to be in the tactical arena. So they're going to be doing publications work, some media relations, special events coordination, those kinds of things.
When you talked earlier about the publics, the groups of people that healthcare public relations people are really focused on, what are some of those, and why are those necessarily different from the traditional publics that we think of in a corporate environment?
Well, I think the fact that you're 24/7, 7 days a week, 365, creates some interesting challenges. In addition to the, quote, normal customers, vendors, employees, and those groups, you have to deal with a wide variety of special interest groups. Our relationships with our physicians is a little different because some physicians are actually employees of the institution. Others just practice there. It's almost like a car dealership relationship where we provide the space, but they in turn use that space and in essence rent it from us. So it's a very challenging environment.
Is it more challenging today than it was, say, 10 or 15 years ago, or less challenging?
I think it's more challenging today. We have had more rapid change with the new healthcare reform bill that was passed. We have dramatic changes in technology that's coming along faster and faster, changes in pharmaceuticals. Genomics is impacting our business. And all at the same time that we're being asked to trim and cut back.
Let's talk about a couple of those changes that you mentioned. The first, of course, is healthcare reform. I know it's really hard to be a crystal ball kind of guy. Can you predict how our business of public relations might be changed by the recent passage of the Healthcare Reform Act?
Well, I think one of the things that it's going to do is to push us back to communicating better with a public that really has been kind of on the outside, the previously uninsured, the folks who live just barely above the poverty level that are now going to enter the system perhaps for the first time. And in many cases, they won't know how to use the system. It's complex, how to get to a primary care physician and then maybe a specialist for services, not using the emergency department because it's more costly, and going to primary care instead. That's a complex process to explain to someone who may be not well educated or has never experienced the healthcare system.
And I think your points are well taken. We have this whole population that's never been served before. Transitioning from that change that clearly we're going to face to a change that we're facing right now and that I know that you're dealing with on almost a daily basis is that change of technology, particularly in this era of social media. How are hospitals exploring social media or using social media?
Well, it's interesting. We see the gamut. We see some institutions being pretty aggressive about it. Kaiser Permanente, for instance, in California, is pretty well on top of it. They use email, push emails. They use Twitter. They have a presence on MySpace. They have those kinds of things going. Where I work, St. Francis, we're a little ahead of the curve. And we've got a new media manager that's very, very talented and keeps us on top of the new media. But I think the real challenge in technology is on the clinical side, because those changes are so dramatic. The federal government and other entities are pushing us into an electronic medical record. Ready or not, here we come. At St. Francis, we're on a fast track to completely revamp our medical records system in 18 months, and that's a normally 3 to 5 year process. But in order to get some of the federal dollars, federal stimulus dollars that are available, and the fact that our system has purchased a large one product serves all product, we are the first hospital in our system to go live with that, and so we've been pushed to do it in 18 months. It's going to be very challenging.
It sounds very challenging. One last question, if I may. What do you see as the future for healthcare public relations? Is this an area that young people should be looking at?
It's a bright future because healthcare is here to stay. We're going to need more of it, not less of it, and the communication channels and challenges continue to grow.
Well, that's good advice. Fred, thank you for joining us today.
You're welcome, Bob.
We thank you for joining us on this edition of Explorations in Public Relations, and we certainly hope that you've learned something about public relations in the healthcare arena. Please feel free to join us in the future as we explore further arenas of public relations.